This is Dr. Kenneth Lewis, and this video is for patients who have been scheduled for genicular nerve blocks for knee pain. We have the ability to turn off some of the painful sensory nerves to a knee if a knee is the main source of the pain and it's a knee that is not a candidate for either initial surgery or further surgery. We always wish to inform the patients that this treatment is not designed to treat the actual pathology that is causing the pain within the knee, but simply turning off a significant amount of pain from that knee. This is for patients specifically who've had total knee arthroplasties but still have knee pain, or have knee pain that is not a current candidate for larger surgical procedures. And what this procedure involves is taking very small 27 gauge needles and placing them on 3 of the genicular nerves that go to the knee capsule and placing a small amount of local anesthetic on those nerves. Initially, this is a diagnostic block. You'll come in on that day. We would encourage you to have a small amount of sedation, but once you're ready, we'll take you back to the procedure room. In an upright position as you're facing up, we'll clean off your knee and we'll place 3 small numbing shots, 1 below and 2 above your knee. And those shots are specifically targeting the genicular nerves. And once they're anesthetized, we will give you a pain log, and then you'll monitor whether or not this has successfully treated enough of your pain to move forward with the actual radiofrequency treatment. If you find that there is a significant amount of relief, then we can schedule you for another day to come back in for the actual radiofrequency treatment. And on that day, it'll be a very similar process. A small amount of sedation will be provided. We'll clean off the knee and numb the skin again, but then we'll take a radiofrequency probe, which is slightly larger but still small, and advance it onto the same nerves that had been previously tested. Those nerves will then be anesthetized again with local anesthetic. And this time, while the nerves are numb, radiofrequency energy will be added to the tip of the needle, and that is simply like a small microwave. It vibrates the water molecules at such a high frequency that they heat up, and they heat the tissue to just the right amount that nerve tissue, which is very delicate, simply falls apart. Now that same section of nerve that we had success numbing with is now removed. Now when the numbing medication wears off, there'll be a segment of nerve that's missing, and that knee will then have that same level of pain control until that nerve regrows. That can take anywhere from 6 to 12 months. If this is successful and you're still not a candidate for any further major orthopedic surgery on that knee, or choose not to have that surgery, then that procedure can be repeated. We do not have to do another medial or another diagnostic block. We would simply bring you back in and localize with local anesthetic and add the heat once again to remove the nerves if the nerves have regrown. So this is a common procedure in our practice and can be very successful for some patients and treat a significant amount of their knee pain. You simply need to understand that it's not attempting to actually treat the painful pathology within the knee. It's simply turning off some of the pain signals during that painful period. Thank you.